Welcome to our deep dive into the Hub model's transformative role in specialty and rare disease patient support. So today we will journey beyond the numbers to reveal how personalized patient engagement not only enhances adherence, but also empowers patients and healthcare professionals to navigate complex treatment landscapes and confidence and certainly with clarity. My name is Josh Konetzni. I am the Senior Vice President, Head of Business Development at Momentum Life Sciences, as Sean had mentioned. Our organization focuses on helping patients navigate medications with personalized support. And I'll tell you more about that in a second, but I would love for Melissa to introduce herself.
Sure. Good afternoon. Thanks so much for the opportunity, Josh, to participate in this webinar today. So Melissa Beatty, Zevra Therapeutics, come to the table with more experience than I'd like to admit simply because I age myself every time I do it. But I've been in the industry now for over 20 plus years. Actually launched the first hub back in the day, as we say, under Priority Healthcare Distribution. So the late 1990s, early 2000s. So truly have been involved in patient services since their conception. Lived the first 13 years of my career under the vendor side of the industry. So absolutely can empathize from the vendor partner side, the challenges and nuances on a daily basis. But lived there for 13 years under a very large PBM organization, and then subsequently came over to what was then called the dark side, to small startup biotech, and have been there ever since. So really going into small biotech organizations who are emerging really to either change decisions they potentially made or build something to really be able to allow those companies to be birthed per se and grow. So happy to be here.
That's great. We're very happy to have you, Melissa. Your background is phenomenal. Love that you cover, different areas of our ecosystem within pharmaceuticals. So that's awesome. Before we get started, I wanted to let you know a little bit about our organization, Momentum Life Sciences. We are at the forefront of patient and HCP engagement solutions. We personalize in, we specialize in personalized evidence-based interventions that empower individuals to take charge of their health. Our approach really to this hub model is rooted in a deep understanding of unique challenges that are faced by these specialty and rare disease patient populations. So really, it's about us integrating digital tools with the compassionate human interaction, and that really helps us to deliver tailored support to patients and ultimately help to those patients to start their therapy, start it the right way, and to help them stay on their therapy, and all the while providing a fantastic experience for those patients. So let's get started. We're going to kind of hit you with a number first, and that is that we face a critical challenge: ensuring greater adherence among specialty and rare disease patients. And this is going to be a big focus, obviously, for what we're going to talk about today is how hub models, how they're kind of built, what are the options out there, and we're going to talk about the advantages and disadvantages of some of those options. Now, according to NORD, the National Organization for Rare Disorders, up to 65% of rare disease patients discontinue their medication. Get this, half of them are stopping that medication within the first year. And these are critical medications for these individuals. So this highlights the unique barriers that these populations encounter, from complex treatment regimens to emotional and psychological hurdles. So Melissa, I have to ask you, is this statistic surprising?
Yeah, I'm unfortunately not surprised, having done this for quite some time. And I think a major driver of this in today's environment is really the value of the treatments that have come out as of late in the last couple of years are predominantly what I call invisible to the patient and the caregivers, meaning that, they don't feel any different. And many are targeted. And the reason for that being many of these newly launched therapeutics are really targeted at impacting the disease and disease progression. They're not necessarily there for side effects. So if we think of the good old days of the, RA therapies in particular, those were something that patients were trying to address full on. It impacted how they looked, how they felt. And in today's environment, that's simply not the case, because if a patient doesn't feel or see or look different, then they do question and forget to take their medication, especially when you're talking about expensive medications, which we also know there's an increase in rise in cost in specialty particularly in rare disease. Now, I say all of this with the caveat that, of course, if you're dealing with a pediatric indication, you do have a little bit of a different outcome here because you have caregivers, mostly parents, taking care of children who tend to be a lot more compliant and on top of their care. In addition to patients just not feeling or looking any different, I would say that a lot of the medications as of late actually make you feel worse. So I would challenge anybody to look at, especially rare disease and oncology, look at those particular therapeutic areas and try to find a drug that doesn't have fatigue as a side effect or doesn't have GI symptoms as a side effect. And so you're dealing with medications that make you feel worse, so you don't see a benefit, you see a disadvantage. So for those reasons, I'm not surprised by it. And again, just the blockbuster days of the past are gone, right? Now we're dealing with much smaller patient populations. And to your point, Josh, those that are much more complex in managing, they're very holistic in nature. And so this indeed is why patient support programs have to be tailored and robust in today's environment.
Yeah, thank you, Melissa, for that. It's really understanding what defines adherence in these kind of contexts is crucial. And there's like you said, there's just so many reasons why a patient might stop taking a medication. When we look at specialty populations, such as those with inflammatory conditions like RA that you'd mentioned, oncology, diabetes, HIV, AIDS, these represent a small group of patients. So it's actually, with many of these, it's less than 5% of the US population. Yet they account for over 50% of the total drug spend. Now, meanwhile, rare diseases, they affect fewer than 200,000 people per condition, but they collectively are impacting 30 million Americans. So you have like these crazy dichotomies that are going on here. And even Melissa, you've even, in our discussions talked about how, many of the rare diseases are even more rare. Medications, there's a plethora of medications coming out for even orphan drug medications. So there's a lot of change that's occurring. So this rise in specialty and rare conditions, plus the adherence challenges, really affirms the need for pharma to better understand and advocate for effective patient support. So this is why the hub model selection and the measurement are so important, and that's what we're going to talk about with this discussion. Here's another stat for you. Our mission is to really bridge this gap. So Melissa's mission, our company's mission, anyone that's working in patient support wants to bridge this gap, and this is a big one. So 61% average improvement is shown in medication persistency when there's personalized patient support. So that's incredible. So you're helping a significant amount more patients continue to take their medication, giving them the support they need, the tools they need, the motivation, the confidence they need. So by leveraging evidence-based interventions, we aim to empower patients to start and stay on their therapy and ultimately enhance their quality of life and their health outcomes. Because that's the whole point of this. They're taking medications to feel better. Let's make sure that we can keep them on those medications and get what they need. Melissa, I'm going to turn it over to you. You're the expert in the hub side of things. You've been doing this longer than everyone, which I can't believe, but let's hear it.
Yeah, so I think I mentioned this early on, and this slide just drives home the point that I feel old. Unfortunately, my career has been across all of these timeframes. I did want to just take, I think, thank you, Josh, for the opportunity. I think, certainly looking at the evolution of hubs over time is critical because it's oftentimes, as in life, you kind of learn what not to do, what to do, and it's usually a leading driver of what happens in the future. So like I mentioned in my intro, back in the late 90s, early 2000s, this was really the rise of specialty pharmaceuticals and access challenges, right? It was also, not shockingly, the rise of hubs at that point. They were born in the SP space. And that's really because the rise in cost and the access challenges were becoming something that the payers were wanting to manage. Of course, they were wanting to manage the cost side of it. But if you look at kind of the past PDUFA dates, this is the time frame when your high cost specialty medications really coming to the market. And quite frankly, it required a reaction by manufacturers. Manufacturers could no longer count on demand automatically contributing to or resulting in revenue. Patients were going without that first script being filled. Additionally, SPs had to figure out how to do things better. The good old days of pick, pack, and ship were long gone. It was much more so hands-on. And to your point, and what your company solves for today, Josh, this is really where that hands-on, very targeted, very supportive environment had to grow. So you kind of look at how we started, then you look at the expansion and standardization. So this is really where third parties started to see an opportunity to fill the void or fill the gap. For those that have been around for a long time, you'll remember the hub light model, the hub light terminology. And so hubs were trying to figure it out, and third parties said, "Hey, well, wait a minute, that's not a standard a specialty pharmacy practice. I can build that. We can do it." And so you really start seeing that. At that same time, manufacturers also saw an opportunity to say, hey, if it's not built yet, why don't I just build it in-house? Why don't I internalize and insource this model? And so we saw a lot of that happening in that mid 2000s, early 2010s. And then you kind of come up on the 2010s, 2020s, and this is really where data, where technology really became critically impactful in the evolution of hub models along the way. And so those companies, tech companies, and even your data aggregators, particular data copay vendors, commercial copay vendors, really said, well, why not? Why don't I get into this space and then I can do it all? So it was kind of the era of the why not? Let's just bring everything in house from a vendor standpoint. So this was really the world of consolidation. This is where it began. And then we find ourselves where we are today, right? Present day. So now we've seen all this shifting over time. We've seen technology, we've seen advancements in data that are absolutely unbelievable and amazing. And the question becomes, what do we do with that today? So I think we'll continue to see this change over time of hub vendors and kind of how the services are integrated at the end of the day, whether you're talking outsourced, insourced, hybrid. But this is really a very exciting time in the industry.
That's great. Thank you so much for going through that, Melissa. And I think, where we've been as you said, will take us to where we are today, and then we'll talk a little bit about the future as well. As we explore the evolution of these hub models, it's essential to understand the different structures that have emerged to meet the diverse needs of these specialty and rare disease patient populations. So we have three primary models that we'll review. The first model is a fully in-source model. So that's a model where it's the organization, the pharmaceutical organization, is really doing, most if not all of these patient support functions internally. Now, on the other side of that, we have our fully outsourced model, and we'll talk more about that. And then we have a growing trend, and that is the hybrid model. And that's really where our focus is going to be, because it is a big trend that Melissa and our organization see as well. But let's start with the fully in-source model. This offers complete control and quality assurance for a pharmaceutical company. This requires significant investment and robust internal infrastructure. The coordination internally is also very significant. However, it may face challenges. There's scalability challenges, there's feasibility challenges as well. Now, conversely, the fully outsourced model leverages specialized expertise and scalable capacity. So this frees those internal resources. It also helps to necessitate a strong collaboration with external partners. Like, that's the key to this. So the flexibility is there. The control is a little lacking from this standpoint. In comes the hybrid model. So the hybrid model combines the strengths of both. So it integrates in-sourced and outsourced components. This is where real flexibility comes into play, as well as adaptability, especially in shifting markets. And we'll talk a little more about that. So this approach allows an organization to strategically focus on expertise that aligns with the patient, the business, and even the regulatory needs. Now, as the market evolves, hybrid models are increasingly favored for their ability to adapt, and especially to changing regulations and patient needs. So this really ensures that we maintain a solid core of hub capabilities while embracing innovation and integration. So Melissa, with that, do you think there's a trend towards hybrid models? Well, I know you do, but tell us why this is happening.
Yeah, absolutely. I think you've touched on a lot of the reasons why here in this slide, Josh, and in your talking points. I think the future is unknown. The future is very chaotic in this at this point in time. Whether you're looking at it from a political landscape, whether you're looking at it from an economic standing, and so hybrid is the way to go. I couple that uncertainty of the future in our industry along with the fact that, every brand, every manufacturer is so extremely different. I think, we used to think of things as very broad buckets. We used to look at things with a very broad brush and say, okay, well, if it's this patient population, then you need X, Y, and Z. And I think, I use the 80-20 rule. 80% of what I do for every brand, I take to the next brand because there are some fundamental things that are consistent. But that 20% is the most critical aspect, although it represents a smaller percentage of the pie. Not one size is going to fit all in today's environment. You could have two products in the same class, but have very different needs depending upon your label. Your internal needs could be very different depending upon, are you a public company or are you a private company? Um, to your point earlier, a lot of the marketplaces today are extremely competitive. So, how many of the competitors are there? What's your size in comparison to those as an organizational standpoint? What's your market share needs? What is your definition of success? And so, all of those variabilities, just to say that indeed there is not a one size fits all, even if you have two products in the same class. So, this hub model does give you that scalability and protects you from the uncertainty.
Yeah. The other thing, Melissa, is integration. So integration, because now you're bringing in there's different partners, there you have internal systems. Um, and we see this with the clients that we're working with, how unbelievably critical integration is, and that is how you are essentially how data is flowing, and being able to get as much of a real time sense of what's going on for a particular patient. So what we see is that patient support programs that use these hybrid models can really help to reduce any kind of abandonment, like first script abandonment, and also increase persistency if they're doing this right. So to do this effectively, you really need to focus on data integration as being like a core aspect of the implementation, as well as ongoing through the program to make sure it's optimized and doing what you need it to do. This is the cornerstone of how these programs are going to work very well. In these various models, the ability to seamlessly connect and analyze data from multiple sources is absolutely crucial. And this is also what helps to drive personalization. It helps to drive the proactive interventions that we've been talking about. Those are some of the keys to help those patients stay on therapy. Um, you also get the qualitative side of it. You get comprehensive insights into essentially patient behaviors, into their adherence, even into the outcome side of things. So this really helps to bring about more breadth and learning about what's going on so that you can use that to inform, really critical decisions of how you support patients. You kind of talked a little bit about this, Melissa. It's consolidation. So a lot of these partners, the solution providers that are offering these types of services, we're seeing consolidation right now. There's different companies coming together, merging, acquisition, things like that. This is happening within hubs, copays, other partners. What impact does this consolidation have on their ability to deliver strong patient support programs?
Yeah, consolidation is fantastic if it can be done correctly, but it is a heavy, heavy lift. For companies to come together and truly be integrated, to your point, Josh, and in the absolute critical nature of integration, that's usually a 3 to 5 year time frame. So just because somebody consolidates today does not mean that you're going to get that consolidated experience the next day. It takes time. And that's not, a negative against anybody. It's just you're bringing systems together. Obviously, you've got multiple facets. I mean, let's just talk about legal and compliance. You're going to have 20 different opinions that you need to figure out as a now combined organization. What is your stance on certain things, and what do you need to have in place maybe that you haven't had in the past? So I would say that consolidation in whole is great. Early on, though, it will feel, and you have to keep reminding yourself, it will feel like you have multiple partners. And so from someone in my chair, I say you go into it with open eyes and understand what it really means and how that can shift in a very positive way over time. But if it's a recent consolidation, then you may feel like you're dealing with different partners, which is fine. But again, integration at that point, to whatever extent it can be done, is absolutely critical to be successful, whether it's a consolidated model or not.
That's great. Well, thanks for your perspective there, Melissa.
Yeah.
So the market is shifting considerably. We have blockbuster medications that are going off patent, and actually quite a few are going off patent. There's a big change that's happening in the market over the next few years. Um, Want to understand your perspective, Melissa, on where this will impact, especially these specialty and rare disease medications.
Yeah. So this patent cliff is scary, especially sitting in a manufacturer's seat, right? Really, you're going into the abyss, the unknown. And I think that this will further, and the reason that I answered previously, such as I did relative to hybrids and that really being the trend, this will just further the need for that. I think the days of internal hub models are probably well gone. Um, because reality is, for new manufacturers at this point, with this patent cliff, with all that we've already talked about, you have to prove that you can be successful before you fully invest. That's just the reality of small startup. So you're not going to go gung ho all in day one. So you need that scalability and flexibility. And again, you're really just trying to prove, can you be successful? And especially with generics coming to market, right? The days of generics being dirt cheap, I'll say, for lack of a better word, are long gone as well. If you're in a competitive branded market, generics will indeed be cheaper than you. They probably won't be cheap by any normal definition. And they're not going to invest in the programs that you have. So you have to be very thoughtful around your competition in the marketplace. This patent cliff for manufacturers who are existing, the long-standing behemoths in the industry, you have to remain successful and you have to prove that you can remain successful. So to compete with lower cost products that don't have the investment in patient services, then you're going to have to better spend your dollars, and you're going to have to shift your dollars over time and where they're being spent. Um, so yeah, it's scary.
Well, and then on top of that, there's a lot of different types of treatments that are coming to market. So now you have, and we have to consider this with patient support, is the biologics are getting, they're progressing. Cell and gene therapies are becoming even more commonplace. So they're really all emerging as groundbreaking advancements. I mean, this is all obviously offering great hope for previously untreated conditions for so many patients, which is wonderful. But we need to make sure that these therapies are providing the specialized care and that a patient deserves. They need to be utilizing robust data integration. The partners and the type of work that the partners doing are way more complex now than they've ever been. And we really need to make sure we're making personalized patient engagement the cornerstone for patient support. And it's integrated data systems that these types of patient support organizations, whether it's a hybrid model or whatnot, they really need to ensure they're providing precise support. They need to put a lot of effort into, how do they enroll patients? How do they provide long-term support to patients? Um, what are the types of hub models that make sense for each of these types of pharmaceutical organizations? And I know, working and talking with many of them, that again, they're all across the board. They're doing hybrid, they're doing insourced here and there, they're doing outsourced here and there. So it's really interesting what's going on with these new types of treatments and how they're being supported. Melissa, anything else to add to cell and gene
Yeah,
therapy?
I think this just adds to the scariness of our future, quite
Yeah.
frankly.
Yeah.
Uh, cell and gene are areas that, to your point, are absolutely amazing, and I can't wait to see the benefit they provide to patients. But it adds another layer of complexity to an already uncertain market. I think if you're a manufacturer going into cell and gene, there's another layer of services you have to consider relative to your patient services or hub models that haven't been in need in the past. And that's really talking about diagnostics, genetic testing. We know as we know as a society that genetic testing isn't where we want it to be, isn't where we're capable of being. And there's a lot of reasons I won't go into, and maybe what my personal opinions on why that is. But absolutely, this needs to be genetic testing, diagnostics, are going to be a critical part of hub services going forward, not only in helping to bring those to patients as an option, but also how do you integrate that visibility and that knowledge into your market and into your data at the end of the day, because that's going to be a critical factor for that patient experience.
Yeah, yeah, that's great. And I think, we keep kind of hammering this in it because it's such a critical aspect, but it's like, what are the trends going on? And again, we've really talked a lot about this hybrid model. I would say of the clients we work with, a lot of times we do get asked, what kind of trends are you seeing with this? Are you seeing more companies starting to go in-source or more starting to go outsource? Um, and I even get their opinion a lot, and it's really interesting. I'd say 50% think that it's going more in-sourced and 50% think it's going more outsourced. So this is an anti-trend that's going on. So it's really not one is necessarily overpowering the other. It's really that the trend is towards these hybrid models. Um, and we're seeing it ourselves that the companies that have historically done in-source types of work are now bringing on certain types of solution providers. There's ways to bring expertise into the mix when you do that, that you bring innovation, you bring change, all of that positive stuff. So as we delve into the realm of these hybrid models, it's clear that we're seeing this significant diversification and change. And as we've mentioned, hybrid models do offer this strategic blend of in-source and outsource component. So this allows us to be adaptable, really, to the changing environments that we've been talking about. As an example, as we talked about the LOE, loss of exclusivity that these companies are facing, it's really meaning that they have to, in some cases, scale this patient support down, unfortunately. And then you have these highly specialized treatments, the cell and gene therapies, biologics, what have you. They maybe have, maybe err towards having a little more insourced in terms of their support, but they're also utilizing services from an external standpoint that really helps them gain the expertise that they need. The beauty of these hybrid models is the flexibility. We've talked about that. And they enable selective focus on expertise that really aligns with the patient, the business, and those regulatory needs as well. So by really embracing these models, companies can leverage the strengths of both the in-source and the outsource. They can ensure the agility and ensure the flexibility that a lot of our, I know our partners are looking for. The next thing that we're going to focus on is measurement. So it's a really important aspect to, how do we make sure these programs are working? How do we make sure they're working for the patient? So I'm going to have you jump right in, Melissa. Let's hear your perspective on measurement. It's complex. It's actually can be pretty highly debated topic for us as well. So love to hear what you have to say.
Absolutely. This is an age-old problem. I think what you see to the left here is kind of the old school way of having done this in the past. I think we need to challenge ourselves as an industry and those that sit in patient services to understand how do we evolve this over time to meet the changes in the industry. But it's complex and debated because at the end of the day, patient services is a cost center. We are not a revenue driving department within biotech. So we're ultimately supportive of the demand that's brought in. So at the same time, nobody wants to or can afford us to spend all the money that they make. So people are bringing in money. We don't unfortunately get the open purse to spend it all. So it is a challenging thing being a supportive organization and trying to provide all of these levels of support that we've chatted about today, that I'm sure all of you have chatted about sidebar in your own organizations. Um, the question is, how do you justify your spend when you can't use ROI, right? ROI is a no word. It's the four-letter word within patient services, not something you can ever say that you're doing. So you have to be able to show that your services and your methods are working to better take care of the patient, i.e., are they getting access to the medications that they need? Do they feel? Feeling is a big thing here. Do your customers, i.e., your patients and caregivers, feel like you've done everything you can possibly do to assist them? And are they able to stay on the medications if they want to and if it's appropriate for the patient? So when you look at the left here, these are all about times, right? This is all time driven. And a patient doesn't necessarily care about the time. You have to look at those outputs and those outcomes and endpoints of, are you giving the patient those three things that I talked about earlier? So for me, that shift over time has been to the left, to the right. I know personally, I'm going through a survey initiative right now. I have not done surveys in probably 15 years. Um, but I'm seeing that come back up as something that we need to, if we aspire to truly make the patient feel better outside of the value of the medication itself, we have to understand where that patient is in their journey. What has that experience been looked like? What do they see value in? Unfortunately, there are very few, there's a lot of treatments on the marketplace in the market, but unfortunately, there are very few cures. And so we have to realize at the end of the day that the medication can only do so much. And I challenge anybody in patient services to put yourself that one step up and say, I want to truly take care of the patient holistically. They understand insurance is a nightmare, they understand medications are costly. As long as you can make them again feel as if you've done everything you can and they've had the best experience they know they could possibly have, then they're satisfied. And that's what we need to shoot for.
Yeah, and just to continue with that, it's so important, and I love your thoughts on how it's kind of gone from the left to the right. I mean, of course, we're still looking at the left side. I think those would be more of your kind of leading indicators, right, to make sure we're kind of hitting the nuts and the bolts of what we need to do. Um, and it's really the engagement and the adherence that are becoming so key. We need to make sure patients are involved, that they're engaged, that they're getting what they need from the support, they're picking up the phone, they're opening the email, they're using the app, whatever that might be. We also need to look at this from a business standpoint. We need to make sure that these programs are having the positive impact that they need to have from a business standpoint, that more patients are able to start therapy, more patients are able to stay on therapy into their second fill, into their third fill, and then ongoing persistency. These are really critical to use because you talked about this. I mean, getting the investment for these programs is very challenging since it's a support, it's not obviously revenue driving. So we have to look at this in terms of how can we show the value of these programs in a beneficial way to the business and obviously to the patient as well. And that's where things like Net Promoter Score come into play. Our patients, would they be willing to refer this type of support to a friend or family member? That's kind of the basis for Net Promoter Score. These are important ways to assess these programs to make sure that we're hitting on the mark, that we're doing the right thing. So that's great. Thank you so much for Melissa for going through that. We're going to go to kind of the next part of this, and just talking about what's behind these numbers that we're looking at. There's the kind of quantitative, but then also the qualitative side of it. So Melissa, knowing that there's inherent limits around kind of the data that we can get access to and things like that, what can patient services teams and leaders communicate more effectively to convey the value of the investment that they're putting out?
Yeah, I honestly, Josh, don't know that there's an answer to that today. I would say that ultimately, showing these types of things is a much more cross-functional skill, cross-functional approach in today's environment. If you look at specifically therapeutic areas in which there are any type of guidelines out there, working with your quality of life, right? Guidelines are typically driven by quality of life. And so working with your colleagues and counterparts in medical to understand what those are so that you can capture that information as part of your services, incorporate it into your talking points and your call messaging. And include that in your data output. Um, that's going to be critically important. And I think that that helps too when you start talking about cross functional exercises and cross functional initiatives. That helps with some of the challenges we've had in the past of getting those dollars, and being able to show the benefit to the organization in a form that's not, of course, ROI. So I think this becomes a group effort, a team effort across your organization to get to this point. And so teamwork and collaboration is critical.
Great, thanks, Melissa.
Yeah.
And it's really, what lies ahead, right? So we've talked a lot about what's been going on, the trends, the anti-trends. Um, there's a lot going on right now. We're already, being, AI is all over the place. I don't have to say that. It's becoming even more and more common in patient support. We're finding AI pop up in many different ways. So as this becomes more sophisticated, and we know that it will and that it has to, we can use AI and things like NLP, natural language processing, to evaluate, for instance, calls. We can look for sentiment. We can spot any kind of trends that are going on in discussions, keywords, certain topics that patients are starting to bring up. This really provides insights into the qualitative aspect of the patient experience. This is something that, we just talked about surveys. This is something that we've been getting from surveys. We've been getting from kind of longer form, in-depth interviews. But that's hard to get. And sometimes there could be bias to that. This is a different way to get that sentiment and really even that kind of behavior in a very kind of automatic AI way. But I'd love your thoughts, Melissa, on AI and model optimization and kind of what you're seeing.
Yeah, I think it's critical, and it's a really good point. And I think it kind of nicely dovetails to the last slide we talked about. And how do we qualitatively get things? You're absolutely correct. One of my biggest fears and what's keeping me up at night is my surveys, and I'm going to get an N of 2. And you're only going to hear the bad, not the good, right? That tends to be how those things kind of go. So
Mhm.
I, in my past, have been a little bit reluctant on AI, if I'm being completely honest. One, probably because of ignorance. Two, because of just working for small biotech where funding is always a challenge. Just seems like a pipe dream of something I'd ever be able to have. But I do think that, data is data points. People filter, sort, pivot table, and you get a number at the end of the day. Qualitative, that's the exact opposite of that, right? We're not getting a number, we're trying to get something else. And so
Yeah,
I'm interested and very excited to see how AI can start help to fill this gap for us going forward. And I suspect it's something that's going to be used a lot more frequently here in the not so distant future.
absolutely. Yeah. I mean, even since the start of this year, it's already changed. I mean, it's so rapid. So looking ahead, just, with specialty and rare disease medications, Melissa, what are the top three changes that you expect to see in patient support strategies?
So I think that there's going to be decreased spend, although it's counterintuitive to what we're talking about, right? We need more services, more investment, but yet I think on our side, because of the lack of certainty in the future, I think we're going to be challenged for folks that sit in the seat like mine to be able to determine and really pick and choose what we're investing in. And I think it's going to be slow growth. Again, I think I made the comment earlier, I don't see manufacturers coming out of the gate at this point investing in everything. I know for me personally, I'm about a year and a half in our launch and I still don't have AI as an example. So, I think you're going to see a slow burn over time. I think, people will start, manufacturers will tiptoe into waters, see how things work and adjust as need be. Um, and I think you're going to see a lot more, I would hope to see a lot more positive engagement with patients, with manufacturers, than maybe what in the past it was. So if you look at the past, I think today, to some degree, this still holds true to a percent, is, big bad greedy pharma. I think that there's some things happening in the economic and legal landscape that hinder and help that. But I would hope to see, I know a lot of good folks that sit in seats like mine, and so I would hope to see the AI introduction, the other introduction of services, better, tighter integration, that all leading to that better patient experience and starting to change the perception and the paradigm of what hub services are thought of as in the marketplace.
Yeah, well said, Melissa. You know what? If I can conclude that
Yeah.
with something really simple, it is how do we do more patient support and how do we do it for less money? Right? That's it's kind of like what we're looking at right now. I want to do a lot more of it. I want to support my patients. I need to do it in a more efficient, effective manner. And I would say that's what we're kind of going for right now as an industry, and I think that's where we're going to be headed as well. AI helps us to do that, right? As well as other fantastic processes, other kind of data sources, all that good stuff. So I want to thank you, Melissa. This was fantastic having your perspective on. Again, you come from so many walks of life with your career within the pharma ecosystem. So what a pleasure to have you, and thank you so much. I really
Okay.
appreciate that.
It's been a pleasure. Thanks so much.
Yeah, absolutely. So with that, want to open this up to questions that we might have. And I know there had been three questions that have popped up as we were talking. And let me start with the first one. So, and Melissa, this might be a good one for you to take. For companies starting to consider a hybrid model, what's the single most critical factor they should prioritize to ensure seamless integration and maximize on patient experience?
Yeah, I would say don't forget the basics. Um, so although we talked earlier about moving and shifting over time and standard typical things that we monitor, they're still very much critical. But we can't lose sight of what a hub was intentionally built. And having built it, I can tell you what it was. Making sure that indeed you're helping with those patients with the fundamentals, and that really being helping them to overcome those reimbursement challenges. A lot of that is outside of our control of how that's done. So, although I would love to say you can bring in AI and you can bring all these things in to help with those, reality is you control very small portion of that experience and that process. And so, you have to have very strong fundamentals in place. Make sure you don't undercut your patient service programs from a headcount standpoint. Don't try to go cheap and say it's a 1 to X ratio. It should be good enough. It may be, but go into it knowing that in being willing to hear the feedback initially from the market, put yourself in a position that you can flex and scale and change. I always say that if I launch a program and 6 months later I'm still doing things exactly like I did the day one, then I'm not doing my job. So don't forget the fundamentals. Don't get caught up in the flashy, shiny objects out there. The fundamentals still stay critically important.
I'd say one of the fundamentals is listening to your patients, really understanding where their needs are, listening to your HCPs, understanding what their needs are, listening to your field teams, your support teams. Um, that feedback is going to be critical. And that, Melissa, will help you to have optimizations and change over 6 months, right?
Yeah.
Which is, yeah, exactly. So that was great. Thank you so much. So another question, this one is to you, Melissa.
Okay.
From your perspective in navigating patient support and rare diseases, what's been the biggest misconception you've encountered um, regarding the true scope and impact of the hub models that you've worked with?
Yeah, I would say internally, if I'm understanding that question, internally, the biggest misconception, and I deal with this on a daily basis, every company I've ever worked at, so not picking on anybody, is that hubs, you're getting a patient on treatment and then you're all done. So script comes into the top of the funnel, you get that patient converted, you get them over onto commercial product, and then as a hub, our job is done. And that's really just the beginning of our job. So we all know that that's the beginning, and then you've got reauthorizations, you've got need for new prescriptions, you've got patients who are switching physicians because either they're moving or because physicians are retiring, and it's a very evolving market in the physician landscape as well. And so you're constantly looking at, especially in ultra rare disease, you're case managing those patients every day of their treatment. So I'm oftentimes educating on the fact that it may look like, depending upon incoming demand, that we're sitting around eating bonbons all day. You have to remind people of how many patients we've got out there that we are taking care of and that we take that care very seriously. So it's never a cut the rope and we're out. We're there from day one all the way through that treatment cycle.
Thank you, Melissa. Um, and then our third question, it says, beyond the typical adherence, what's a non-traditional metric or unique data point that you found surprisingly effective in demonstrating the value of your program to internal stakeholders? Okay, so this is asking about, are there other metrics beyond maybe what we've talked about and maybe other unique metrics?
Yeah.
Uh, So interestingly, some programs that we have been doing lately, I talked about natural language processing. I talked about the use of AI, where you are you're listening, compliantly listening to these conversations that are being had. In my company's case, it's typically a nurse educator or some other trained support individual who's talking to a patient. It's one thing to ask the patient questions and get feedback from them in the moment. It's another when you're actually using natural language processing to understand things like sentiment. And what's interesting, a recent QBR call is we were letting our client know about three different types of patients who were coming into a call. The first was the positive patient coming in with a positive sentiment. The next was the neutral patient. And then the third was the negative patient. And the whole key of what we were trying to do is, can we increase their positive sentiment, even just a little? And what's that impact have on that? The client was kind of blown away by that, blown away by the certain types of best practices that were used to help provide a more positive sentiment to all three of those categories. And of course, raising the negative ones was like the biggest priority. But we were also able to use that. We were able to optimize because there were some things we were doing that could have worked better. So we're able to adjust how we're doing that. So I would say like that's a really unique way to look at how you're supporting a patient and then how you're showing your stakeholders how you're using these types of tools. Yeah, so hopefully that's helpful. Melissa, any thoughts from you on that?
I think it's a great one. I can't top that one, Josh.
Okay, well, great. Well, I don't see any other questions, so therefore we will wrap up the webinar. Again, want to thank everyone for their time and Melissa, especially for yours as well. Thank you. It's great to be here.
Fantastic. Thank you so much. Truly appreciate you allowing me to join again, Josh. Have a great
Wonderful.
day.
All right. Thanks. You too. Bye.
Thanks, guys. Bye-bye.